On Wednesday, the World Bank alerted that as many as 150 million people are likely to be in extreme poverty because of the coronavirus pandemic. Depending on the severity of the economic contraction, COVID-19 pandemic is estimated to push an additional 88 million to 115 million people into extreme poverty this year, with the total rising to as many as 150 million by 2021. According to the Biennial Poverty and Shared Prosperity Report, the World Bank said that this would represent a regression to a rate of 9.2% in 2017. Had the pandemic not convulsed the globe, the poverty rate would have been expected to drop to 7.9% in 2020. World Bank Group President David Malpass said, "The pandemic and global recession may cause over 1.4% of the world's population to fall into extreme poverty." He also said that in order to reverse this serious setback, countries will need to prepare for a different economy post-COVID-19 by allowing capital, labor, skilled and innovation to move into new businesses and sectors. The new poor will be in countries that already have high poverty rates. The report said that the middle-income countries will see a significant number of people slip below the extreme poverty line, and about 82% of the 150 million will be in middle-income countries. The World Bank said the convergence of the pandemic with the pressures of conflict and climate change will put the goal of ending poverty by 2030 beyond reach without swift, significant and substantial policy action, and that by 2030 the global poverty rate could be down to about 7%. In its report, the World Bank noted that the lack of recent data from India severely hinders the ability to monitor global poverty. Lack of data on India, one of the economies with the largest population of extreme poor, creates substantial uncertainty around the current estimates of global poverty. It was observed that India's effective approach has tapped the skills and dedication of community members. In Mumbai, city officials were able to stem the rapid spread of the coronavirus in Dharavi by mobilizing community members and staff from private medical clinics for a strategy based on mass screening for fever and oxygen levels. In the span of 3 months, by July 2020, reported cases in the area had been cut down to 20% of their peak in May. Many foundations, NGOs and volunteers provided thousands of households with ration kits to help poor families during the lockdown. According to Johns Hopkins Coronavirus Research Center, the contagion has infected over 35 million people across the globe and killed over 1 million people. The US is the worst affected country with over 7.5 million cases and more than 210,000 deaths. The coronavirus, which originated in Wuhan, China, in December last year, has battered the world's economy. With the IMF saying the global economy is bound to suffer a severe recession, scientists from all over the globe are racing against time to find a vaccine or medicine for its treatment. News Desk, Pravasi Insight.